You've been told you have cervical radiculopathy. You know that arm pain, tingling or numbing that goes into that arm, forearm, even hands and fingers? In this video, I'm going to give you 3 great exercises that you can do at home to relieve the symptoms associated with cervical radiculopathy, whether it's numbing, tingling, or even pain down the arm. Hi there, this is Dr. Walter Salubro. I'm a chiropractor in Vaughan, Ontario, Canada. At our office, we help people with chronic spinal conditions improve their spinal alignment and get rid of pain without surgery using corrective chiropractic methods. And our structural care program has helped many people with conditions like cervical radiculopathy or conditions related to disc bulges, whether it's in the low back, like L4, L5 disc bulge or L5S1 disc bulge, or even disc bulges in the neck, or conditions like sciatica, low back pain, leg pain, numbness and tingling. Cervical radiculopathy is an arm symptom that originates from a problem in the neck area when one of these nerves in the neck area, so the cervical spine, gets irritated. And because these nerves, especially in the lower part of the cervical spine, the C5, C6, C7, C8 nerve, and T1 nerve, which is the upper thoracic area, those nerves form the brachial plexus, and those nerves reach into the arm, forearm, and fingers. When they get irritated, and it can be from a variety of different reasons, they will give symptoms into the arm, and that's called cervical radiculopathy. So the 3 exercises I'm going to show you, 2 of them are nerve glides or nerve flossing exercises, and one's going to be a great stretch to open up the shoulder area to help relieve irritation, pressure on those nerves that go from the side of the neck into the arms. Exercise number 1, follow me. Exercise number 1 is a nerve glide, and what you're going to do is you're going to place your hand up like this, and you're going to stretch this part of your neck and do a nerve floss or nerve glide for the median nerve. What you do is you bring your hand and you bend it like this, and then you stretch out your arm. At the same time, you tilt your head in the opposite direction. Okay? So you start like this, tilt your hand away from you, tilt your head away from your hand, and then stretch out and extend the arm. And I feel a stretch right from here, right into the actual arm. Get some rotation in there, get more of a stretch. Tilt the head, and if you want, you can even press down on your shoulder, bring the arm back, and get even more of a stretch. Feels really good, actually, especially for those tight muscles in the neck. It helps strip those neck muscles, mobilize your spine in the neck, and get a gliding effect on that nerve. So again, wrist, extend, tilt your head in the opposite direction, press down, and go back just a bit. Now with these exercises, you never want to go beyond your ability to do the exercise, your tolerance. If it causes pain or increases the symptoms, then you need to back off from this. Okay, so only do it within your tolerance. So once again, like this, extend, tilt the head, extend the arm, bring it back more, rotate backwards, and pull down on the shoulder. And really stretch the neck in the opposite direction. Feels really good. How many times do you do that? You can do it 10 times to start within your tolerance. Eventually, as if it's giving you relief and it's really helping you, then you can bring it up to 15 times or 20 times and even up to 30 times. Minimum once a day, and see how that works out for you. The next exercise, number 2, is a nerve glide exercise for the ulnar nerve, which can also be irritated in cervical radiculopathy. It's a bit more challenging to do, so it's going to require some flexibility. So what you're going to do is you're going to make an OK sign with your hand. And then what you do is you're going to bring your hand upside down just like this, and this alone will begin the actual glide, the actual ulnar nerve glide. Bring your elbow back and even pull it back a bit more, and you should feel a stretch inside the arm, this area here. And then if you're even more flexible in that, you want to bring it all the way up like this towards your face, okay? That will help with flossing out that nerve, the ulnar nerve that goes in the outer part of your arm into your pinky finger. So once again, OK sign, upside down, OK towards your face. When you become more flexible with this, you can actually go right up against your chin and put it against your eye, just like that, and stretch it back even more. Okay, now my flexibility is not the best, so it's really hard for me to do this, but I do feel a great stretch all through there. So it helps to floss that ulnar nerve, which can be also involved with radicular pain into the arm or cervical radiculopathy. Exercise number 3, grab an elastic tubing or some kind of elastic band if you got one, anything that's stretchy, and we're going to open up the shoulders on both sides like this and relieve any pressure from rounded shoulders or rounded posture onto the brachial plexus, which can be a contributing factor to cervical radiculopathy and pain down into the arm or pinching effect on those nerves that come up from the side of the neck. So grab a band like this, and you make it as tight as is comfortable for you. If you need it looser, easier, make it longer. If you need a stronger tension, make it lighter, smaller. And what you're doing is you're gonna grab it like this, put your thumbs up in the air, and then you're gonna bring it back, open up those shoulders, rotate your thumbs back. And I feel a stretch in my pec muscles. Open up your shoulders. If you want, you can get even a chin tuck in there, tuck your chin down and back. You feel a stretch in those shoulders. And it helps open up any compression in this area here due to poor posture around the shoulders, which can irritate the nerves coming from the side of the neck into your arm. There you have it, 3 great exercises that can help relieve any pinching nerve pain that's going into your arm from cervical radiculopathy. And I actually have a great video that you can find right over here. Click right here, right now. It gives you more information about cervical radiculopathy, especially from C5, C6, and what actually causes it. I go over many causes of cervical radiculopathy. Catch the video right here, right now.